Hello, you're listening to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. There's a new study out that demonstrates that a blood test used in conjunction with traditional imaging can, in fact, improve breast cancer detection and more than likely substantially reduce the use of potentially avoidable biopsies, one of the mainstays of breast cancer detection. Our guest today is Dr. Judy Wolf. She's a gynecologic oncologist and chief medical officer at Videssa Diagnostics, and she's here today to discuss with us this new study. Welcome to Health Professional Radio, Dr. Wolf.
Thank you, Neal. I'm happy to be here.
Now, in recent news, Olivia Newton-John has revealed that her cancer has returned, her breast cancer. It's been like 25 years since she was treated for it, but it has returned. In light of that fact, let's talk about a new study that couples imaging with blood tests to reduce some of these biopsies for women under the age of 50.
Yeah, so I think Olivia Newton-John's story is a great example of what drives me to be part of trying to find cancer earlier and diagnosing cancer earlier, is that if we can find breast cancer, or most of all cancers at an earlier stage, we're less and less likely to have women or anyone with cancer have an issue where the cancer either isn't cured or returns at a later date. And so I left a practice of gynecologic oncology where I was treating women with cancers, many of whom unfortunately had recurrence and died of their disease. And I saw a lot of effort being put into more treatments for that area. And I'm so excited to be part of Videssa Diagnostics working on a blood test called Videssa Breast, which will help us find cancer earlier when it's much more easy to cure with less morbidity to women. So the current study that you mentioned is a prospective study that we did looking at women under the age of 50 who had breast imaging that was abnormal in some way. Breast imaging, be it a mammogram or an ultrasound or an MRI or whatever is being used, is scored based on if it's normal, if it's very likely to be cancer, or is it somewhere in between. And the somewhere in between scoring is what is called a BI-RADS 3 or 4. And those, it's very unclear whether the abnormality that's being seen on the imaging is cancer or not. And that's where we thought that a blood test, our blood test, would have the best ability to help sort between likely benign and not cancer and likely cancer and should proceed with biopsies. And so in this first study, that's what we were evaluating.
Early and accurate is the goal. Does this test increase accuracy as well as early detection? Yes,
and that is part of the goal. I mean, unfortunately, imaging isn't perfect. It's very good at in many women at finding something, but not being able to tell is it likely to be cancer or not. And so therefore, lots of women end up having biopsies anywhere between 75 to 90% of the time. They're not cancer. And if you've ever had some kind of medical test abnormal and you have to go through a biopsy, that whole process is painful, anxiety-ridden, and challenging to go through. And so if our test can help direct which women are most likely to have cancer when the imaging is abnormal, then that decreases the number of women who need biopsies when they don't necessarily need them. And actually, in our study, if our test came back and was reported as what's called a low protein signature, meaning not likely to have cancer, more than 99% of the time there was not cancer. And if we looked at the biopsies that were done if directed just by imaging versus those done directed by imaging and our blood test, we could reduce the number of biopsies by 67%. So we're not missing cancer, and we're helping direct the biopsies to be done on the women most likely to need them.
How many women were actually involved in this study, and was this a study that was done in conjunction with any other research entities?
So we did this study in conjunction with 8 sites around the country, both academic and community-based breast cancer centers, and there were a total of 545 women in the trial who were followed prospectively. So women had abnormal imaging, their blood was drawn. We didn't run the test and so the doctors did what they thought was most appropriate for the patient. And then at the end of the day, we looked at what did our test show, what did the imaging show, and what did the biopsy show, or what happened to that woman and how did they correlate. And actually putting the two together, imaging and our test, no cancers were missed. And as I mentioned, with the possibility of adding in our test, reducing the number of biopsies that may not be necessary.
Are there different types of breast cancer that this test is more apt to detect, or is it just across the board breast cancer, and then you decide after that what types of steps to be taken depending on the type of cancer?
Yeah, that's a great question. As we're learning more and more about cancers, and as you may know, earlier this week, the FDA cleared a drug based on treatment of cancers that have a certain mutation, not a specific type of cancer for where it started. And so our test was built to be agnostic as to the type of breast cancer. So whether it's invasive ductal or invasive lobular, or if it's DCIS, the pre-invasive cancer, it's able to sort benign breast diseases from any type of cancer.
Have you been in contact with any other medical facilities, say, around the world, or is this something that's taking place only here in the United States until more data can be collected?
Yeah, currently the test is only available in the United States. Our lab is the only lab currently that's running the test, but certainly we have had a lot of interest from institutions and physicians around the world who are hoping at some point they have access to this test.
So do you think that this test will be widely available within the next year and a half, or is this something that's going to take a little bit longer before it becomes mainstream?
Well, we've already started marketing it to a small group of what we're calling early access physicians. We have about 100 physicians around the country who are using it in their practice today. That's going to help us get more information about how the test is actually used in practice outside of a trial. That's called clinical utility. And as our manuscripts are coming out in our publications, such as this one, it will allow us to more broadly market to the rest of the country. And that should be within the next year to year and a half.
In your experience and your opinion, do you think that it'll be about the same amount of time? You're marketing to a small group right now. How long do you think it will be before it's included in the curriculum when students are studying to deal with breast cancer and any other types of cancers?
Well, it takes a little bit longer for that to happen. So, with publications and we show clinical utility, we show that it has a health economic benefit. All of those things help us prove to insurance companies that that's something that they should cover for women who are on their plan, so that it's widely, easily available for women. And at the same time as doctors are using it, then it starts being included in guidelines like NCCN guidelines and in detection of breast cancer. And so all of that takes some time. And then by the time it gets to training in medical school, it's probably a few more years down the road. But I would say that once it's available and marketed around the country, it goes a little further down in training. Physicians who are training to be breast radiologists, physicians who are training to be breast surgeons, obstetrician gynecologists possibly in residency, who are the ones who end up ordering a lot of this breast imaging for women and then have to explain to them when they have some abnormality. So it's a process. We're trying to do it in a very pragmatic way so that we do what's best for patients and get some information about how it's used, and then introduce it to the entire market when we're ready, and then move it forward so that it can become standard of care first here in the U.S. and then hopefully everywhere where women can be helped by a test like this.
Now, where can our listeners go and get more information online about Provista Diagnostics and this brand new test?
So if they put in Provista Diagnostics, our website will come up. The name of the test is called Videssa Breast. That also can be used as a link to go in. And we have a lot of information for not only for healthcare providers, but for women about what the test is and how we studied it and how it's used and how it was developed.
It's been a pleasure speaking with you today, Dr. Wolf.
And it's been a pleasure speaking with you, Neal, too. Thank you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Judith K. Wolf, gynecologic oncologist and chief medical officer at Provista Diagnostics. We've been discussing a brand new study that demonstrates that a blood test used in conjunction with imaging greatly improves breast cancer detection and substantially reduces unnecessary biopsies in women under the age of 50. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.